Pancreatitis. Pancreatitis is an inflammation of the pancreas. The pancreas is a very important organ that has two functions: to produce hormones and to produce enzymes that assist digestion. When these enzymes are activated before they leave the pancreas, they can start attacking it.
The pancreas is one of the various hormones-producing glands in the body. It is an elongated organ in the abdomen located in space behind the abdominal cavity. It lies beneath the stomach and is connected to the small intestine at the duodenum. The pancreas is often described as having three regions: the pancreatic head, the body of the pancreas, and the tail of the pancreas.
There are two types of pancreatitis: acute pancreatitis and chronic pancreatitis. Acute pancreatitis. It is a sudden inflammation that occurs over a short period of time. The symptoms are upper abdominal pain that radiates into the back, swollen and tender abdomen, nausea and vomiting, fever, and increased heart rates. The principal causes are gallstone disease and heavy alcohol consumption.
Acute pancreatitis. Acute pancreatitis is the sudden inflammation of the pancreas. It can be very painful and usually means a stay in the hospital. About 5% of cases are life-threatening, usually when other organs are involved. The pancreas is a digestive system organ that has two important functions. It produces enzymes to break down food in the digestive tract, as well as hormones that regulate blood sugar. In acute pancreatitis, the enzymes used to break down food become activated before they leave the pancreas. These enzymes are so powerful that they start to attack and digest the pancreatic tissue. This process is called autodigestion. The most common causes of acute pancreatitis are heavy alcohol use and gallstones. Other less common causes include abdominal trauma, medications, infections, tumors, and genetic or anatomical variants. High triglycerides or high levels of calcium in the blood are also linked to acute pancreatitis. In some rare cases, the cause is never discovered.
Chronic pancreatitis. It occurs most commonly after an episode of acute pancreatitis and is the result of ongoing inflammation of the pancreas. The symptoms are constant pain in the upper abdomen that radiates to the back and weight loss, and the principal causes are prolonged alcohol use, certain hereditary conditions, medicines, and gallstones.
Pancreatitis. Chronic pancreatitis is caused by long-term inflammation of the pancreas, which eventually leads to the irreversible destruction of pancreatic tissue. Chronic pancreatitis develops slowly over time and is predominantly triggered by lifestyle factors in predisposed patients, such as long-standing heavy alcohol or tobacco use, although this is not always the case. Other less common causes are medications that put stress on the pancreas, elevated triglycerides, some autoimmune conditions, and some inherited or genetic conditions, notably cystic fibrosis and hereditary pancreatitis. In some people, the cause of chronic pancreatitis is never discovered and remains a mystery. The pancreas is a digestive system organ that has two important functions. It produces hormones that regulate blood sugar, as well as enzymes to break down food in the digestive tract.
Pros and cons. Pros. Sometimes it can be prevented with alcohol abstinence. Cons. It can damage many of our organs if it is not treated on time. Related diseases. Pancreatic cancer. A long-standing inflammation in the pancreas caused by chronic pancreatitis is a risk factor for developing pancreatic cancer. This is a malignant neoplasm originating from transformed cells arising in tissues forming the pancreas.
Pancreatic cancer is a malignant tumor within the pancreatic gland. About 95% of pancreatic tumors are adenocarcinomas. The remaining 5% are pancreatic endocrine tumors. Diagnosis of pancreatic cancer is difficult because the symptoms are so nonspecific and varied. Common symptoms include abdominal pain, loss of appetite, significant weight loss, and painless jaundice. All of these symptoms can be blamed on other causes. Therefore, diagnosis of pancreatic cancer is often late stage in its development. Jaundice occurs when the tumor grows and pressure obstructs the common bile duct. Tumors of the head of the pancreas will more easily give rise to such symptoms. Risk factors for pancreatic cancer include age, male gender, African ethnicity, smoking, diets high in meat, obesity, diabetes, chronic pancreatitis has been linked, occupational exposure to certain pesticides.
Diabetes. Damage to insulin-producing cells in your pancreas from chronic pancreatitis can lead to diabetes, a disease that affects the way your body uses blood sugar.
Diabetes is a common condition that affects all kinds of people all over the world. It prevents your body from making enough insulin and using it properly. What's insulin? Well, insulin is a hormone your body needs to change food into energy. This is very important because your body needs energy to work well. Your body is made up of many different organs, and they do many different things. One of these organs is called the pancreas, which is where your body makes insulin. When you eat something, your digestive system breaks the food down so it can move through your blood and into your cells. Carbohydrates, or starches, are broken down into glucose, a type of sugar. Your cells use glucose as fuel. Insulin moves glucose out of your blood and into your cells. That's so your body can create enough energy to get you through the day.
Pseudocyests. Acute pancreatitis can cause fluid and debris to coalesce in cyst-like pockets in your pancreas.
Video endoscopic procedure by Dr. Abello, supported by a series of 10 pediatric patients with pancreatic collection. This is a 5-month male patient with a recurrent paraduodenal collections after resection of a duodenal duplication with pyloric obstruction. Now, a typical giant pseudocyst in an 11-year-old female child after bicycle injury that extended to the esophageal hiatus, and another 12-year-old male patient with a pancreatic hematoma after 1 month abdominal injury while running in the sidewalk.